In today's episode of the 340 Banter podcast, Logan and I are joined by Donovan Smith, CEO of Wayne Community Health Center in Utah. Donovan shares with us his unique career path as he transitioned from pharmacist to community health center CEO.
Donovan, you have a unique career transition where you just moved from, in the last, year or two?
2 years.
2 years, and time flies, to CEO of your health center from being a pharmacist. So I think that that's a really new thing that we're seeing in the industry, especially in the health center community. I love to see it, and I thought we could just talk a little bit about where you've came from and what you've really experienced in those 2 years.
Absolutely. So a little background about myself. So been pharmacist since 1995 when I graduated from the University of Utah. I started in the retail sector, as many pharmacists do.
Yep.
And then I was able to transition into a directorship in 2 hospitals at the same time. I was actually commuting about 60 miles between those 2 hospitals during that time frame. For some reason, it's a special kind of stupid with 2 O's.
And that's a big change from retail to hospital directorship.
But no, it was all good. Great people, loved the people that I worked with and the hospitals that I was with. But went back to retail for a little while, and then this position opened up at the community health center, and I'd never heard of a community health center, but I was interested and intrigued. So when I got more information about what a community health center really was, and it kind of opened my eyes into the world, I'm like, yeah, I think that this would be a great change for me. So almost 21 years ago, I made that change. Got involved in the pharmacy world there and became the director of pharmacy for Wayne Community Health Center. And it really kind of changed my life. Suddenly I realized that I can treat my patients like they really deserve to be treated.
Yeah.
And that you're having that opportunity of turning to a patient and who doesn't have 2 nickels to rub together to save their life, and look at them and say, okay, here's your medication, and it'll be $5, and have them break down into tears in front of you and extend their arms out and around you. It was the most satisfying experience and I'm sure you've had those same type of opportunities, or anybody that works in a community health center setting. But it solidified me. I was in it for life from that point. It's like, I get it now. I understand why we do this.
I think that as a pharmacist, particularly going from experience or background in retail and hospital pharmacy, where every time you see a patient, it's the worst day of their life, right? Like they're in a terrible place and you're there to help them. But oftentimes you catch the frustration or anger with their situation, and they need an outlet, and you're it. So it takes pretty thick skin, and not that doesn't happen in the community health center setting, but to be able to be there to help them through their everyday, get to a place where they can avoid hospitalizations, help them, really identify what's causing them to get really sick and help correct that at the beginning is really, I don't know, impactful. It's fulfilling.
And what I've always said is that I don't think there's a single pharmacist that doesn't want to help their patients access medication.
Yeah.
But being in a health center, we had extra tools that other pharmacists didn't.
Exactly. And, you make a good point. A lot of times you'd see patients coming in those retail settings when, they're just having a bad day.
The insurance isn't covering something.
And then you have to turn to them and go, I'm sorry, but your medication's $500. And then you catch the brunt of that. And so you have to be understanding towards your patients, and you gain that understanding, that perspective. And so, like I said, when I came into the health center role, suddenly I was able to help those patients. I had a gentleman who would bring in money in a sock. It was just coins that he had, and that's all he had, but that's how he would pay for his insulin. And he would pull his little tube sock out that was probably from the 1970s, and he would dump out his tube sock there on the counter, and that's how he'd pay. And it got to the point, I knew this gentleman so well, I'm like, you know what, I will pay for your medications, just because I felt like I needed, or I wanted to help improve him. And you know, in our community, they're very prideful individuals. They don't want government assistance. They don't want to be, you know, they want to be able to show that they can do things on their own.
Exactly.
And so and I get that, but he just the heck of a nicest guy. But being able for him to finally be able to afford that, and it was amazing. Or the mom who came in and you know broke down in tears, and because she turns to me and she goes, I can go buy a couple gallons of milk for my kids today. And she's like, I've never been able to do that as a diabetic. It's either I go without my insulin or my kids go without milk. And I just, you know, but you hear these stories anytime you talk to anybody. And,
well, and in a regular retail setting, like you said, you know, you have to say, I'm sorry, your medication's $500 today. The patient often doesn't know that you've already tried every trick in the book for every coupon card, anything you can do, you know, if it the insurance isn't paying for it because of the certain dose or what have you, you've already gone through and tried everything you can to bring that price down, and you're out of your Mary Poppins bag is you found the bottom of it. You're out of tricks. And at the health center, you have care navigators that can help look for other ways to access and cover care. You also have the ability to utilize 340B savings to help subsidize prescription costs. You can utilize your own pharmacy for some of the bulk replenishment programs from manufacturers and organizations that provide those
pharmacy organizations,
charity grant funds to cover prescriptions. So all these additional resources that you don't have in the retail setting, you can offer through your health center, and actually
you're integrated with the care team. So if it's not the best therapy, you can work with the provider to get it fixed.
Yeah, and that team mentality is absolutely incredible. When you have that opportunity of working directly with those providers and you become part of that healthcare team, the integrated team, whether it's, from dental to behavioral health, in our cases, and medical and pharmacy, we're just all one big unit to make sure that we're improving the patient's lives as a whole. And that's such an incredible thing. And so, I did that for 18 years, and stories go on and whatnot. And then, I was able to transition into the CEO. I've actually had this position now twice. Many people don't know that. So the first time I was actually offered a position, and I accepted it for a week and a half. But at that point in time, I think I was still just not quite ready to make that transition. So they brought in another CEO in that interim, and he was there for 5 years. And but then after which I then took the position again, or submitted my name in for a position, and I was selected out of the applicants, which kind of still surprises me to this day that they chose me. But no, I'm happy to take on that responsibility. I love our organization, and when I say that I love our organization, I mean that means the patients of our communities that we serve, just absolutely the best people on the planet, to the staff, whom I wouldn't trade out a single member. They dedicate their heart and soul to our mission every single day. They come to work with a smile on their face. They're laughing. They care more about the patients a lot of times than they care about themselves. And so, when the opportunity presented itself, I looked around and I saw rooms of giants from my staff, and I just happened to be that lucky individual that gets to stand on their shoulders and steer the boat. And it's been
not a short joke.
Not I have lots of those, but not a short joke. Yeah, but no, it's been a unique change for me. And I think one of the biggest changes for me has been that you see the health center in a different light. As a pharmacist, you're very focused on your individual department, and you're doing, like you said, everything in your power to make the best experience for your patients, for them coming in. That they're the princes and princesses of your organization, and that's how they should be treated when they come to your organization. But coming into the CEO world, you look at it and you're like, okay, do you know what? You see that this is also happening in the medical department, in the dental department, the behavioral health departments, and your vision expands, and it's a unique perspective.
What would you say from your experience as a pharmacist helped or created barriers in your transition to CEO?
I think that it helped me having the experience and working as a pharmacist in the organization for me to understand what the mission of the organization was. It took a little bit of time. When I first came into the position, I kept thinking, I'm like, man, we are going to be losing, our shirt if I continue to sell products at this price. But it took me a long time to understand how the world works in health centers and in our grant funding, and how our charitable care and our grants that we're getting from those gracious individuals that donate help out our patients. And it, I use the term, it's the first time in my opinion that medicine was ever done right. That we are there really to make sure that our patients succeed, and some of our patients, we've got about a 40% federal poverty population within our area. And it's just, we just don't make a whole lot of money at where we're at. It's a very agrarian society, but it fits for a health center. And I don't think that you could have a hospital or any type of organization, even a private practice in our area, and have it be as successful and provide the services that we've been able to provide in our area if it wasn't for an FQHC status.
Yeah, that's great.
I can imagine going from pharmacist to CEO, it being helpful to have an understanding of the business aspect of pharmacy. I know that from personal experience, there's often a challenge in leading the pharmacy department and then working with the rest of the leadership, the finance leadership, the CEO, in creating realistic expectations. I don't know how many budgets I've had to write and rewrite as the leadership comes back and says, no, we need another $750,000 next year. We need you to find that in your budget. And I'd have to go back and point to
the couch cushions.
Dig through the couch cushions, point to the budget for visits and say, okay, well, this is how many prescriptions we get out of our visits. If this is how many visits we're budgeted for, this is likely how many prescriptions we're going to get. Here's, this is where we're sitting. And I know that was often a point of strain for everybody on in that conversation. And I can imagine that just understanding the basics of the pharmacy business can help from the CEO perspective, because in health centers, there are very few places where you actually make money to help keep the doors open, and pharmacy is one of them. But understanding how that puzzle piece fits in, I imagine could be helpful. Did you find that?
Oh, immensely. When I first, I've always been a pharmacist who tracks my own metrics, because how am I to be able to understand what's going on within my pharmacy and be able to defend, my labor, my staff, and if I didn't understand and know what's going on. And so my initial Excel spreadsheet that I started out relatively small, probably 8 columns in it. I think I'm up to like the BE column on my spreadsheet, because it just continues to grow.
Impressive.
It's like, I want to know this. I want to know that. I want to know how this is going to interact with this. I want to know how many prescriptions per provider that I'm going to be able to expect per visit. I want to know, okay, what's my, cost per prescriptions. I want to be able to understand how everything fits together, so that if when somebody comes to me and says, hey, I want to expand this program, how is that going to impact pharmacy? Then I have that capability of being able to say, well, this is how it's going to impact, and this is what your expectation should be. But without the metrics, you wouldn't be able to do that. And I'm glad I did that, because you're right. Moving into the CEO world, that same mantra kind of comes into play, where you're having to predict the future. I often say, my crystal ball in my office is really what they want. They don't want me. They want my crystal ball, being able to say what's going to happen in the future. But you bring all of that to the table with you.
Awesome.
So, one of the, being a pharmacist, one of the first trainings that I got as an FQHC was my Be Nice training. And for those that don't know what that is, that's your biological, nuclear, incendiary, chemical, and explosive training.
That is a misleading acronym.
Yes, it's a very misleading. But in my role at this health center, I have checked off every one of them except for nuclear. I've had experiences with biologics exposures. I've had experiences with incendiary, things with fires, chemical exposures with our town being exposed to organophosphates due to a chemical fire. Explosive training when our propane depot next door to our clinic caught fire.
I like a different kind of explosions.
So but
That's rough.
I once had somebody say, you need to move out of your small community to a nice big city where it's nice and safe, because of the things that we've been able to experience. But, I wouldn't change it for the world. This has been a whirlwind of an experience, but just a fantastic place. And I'm glad to be able to lead it from this point moving forward.
Yeah, it's great to see pharmacists stepping up to those C-suite positions. And really, I think it's great because it shines a light on all the unique ways that pharmacists set in the healthcare space, because we look at things differently than every other healthcare professional, and we're really balancing that clinical and financial and operational mindset. And I think that it's a great way to utilize those skills.
Yeah, pharmacists are natural born leaders. You see that a lot of us are type A personalities.
We are.
And we want, we really want to be able to serve our communities and make the biggest possible impact for all of our patients. And I don't think that you're going to see that anywhere, that is going to have that dedication and drive like you do in the pharmacies, because sometimes it can be a thankless job. Yeah. But at the end of the day, sometimes it's also one of the most rewarding jobs that you can also have, and they bring a tremendous amount of skill sets.
Thanks for sharing your experience with us.
Absolutely.
Appreciate it.
Thank you.
Thank you again.
Thank you for listening to 340 Banter. This podcast is produced by Grit and Gravel, your partners in marketing strategy and success.